After that deep dive on maternal health, let's examine the state of infant health in this country, the barriers and disparities that exist, and the efforts that are being made to address them. Please join me in welcoming Dr. LaQuandra Nesbitt, Director of the Washington, D.C. Department of Health, Twinkle Schottke, co-founder of Moms to Be and Program Director and Infant Health Specialist at the Ohio State University's Wexner Medical Center, Dr. Billy Lou Short, Chief of the Neonatology Division at Children's National Medical Center, and Stacy D. Stewart, President of March of Dimes. Rachel is back to lead this conversation.
Well, thank you so much for our second panel for being here. It's no secret that infant mortality in the U.S. is higher than many developed nations. Twinkle, I was wondering if you could tell us a little bit about your group, Moms to Be, and what you guys are doing in engaging women to try and keep babies healthy and kind of curb this trend.
Absolutely. So in Columbus, Ohio, we have a group called Moms to Be, and we meet every week at the same time, at the same place, at the same location. We've been doing that for 7.5 years. We do a 2-hour education session. Our whole goal is to have healthy babies. So the only criteria for admission is to be pregnant, and then we keep the moms in the program until the babies turn 1. Infant mortality is first breath, the first birthday. Our whole goal throughout the pregnancy is to talk to mom, meet her where she is in a non-judgmental attitude, feed her, give her a lot of special attention. We have a dad's program, we have a program for siblings, and we work really closely with our babies right after birth and all the way until their first birthday to just help them developmentally stay on track.
Mm-hmm. Dr. Short, can you tell us a little bit about how prenatal care comes into play here?
Yeah, I think our journey at Children's Hospital, I run a NICU that's a 60-bed intensive care unit for babies. So the journey starts with that panel prior, in that this infant or the fetus that comes out becomes an infant and comes to our institution if there's complications. So having prenatal care is just essential. Having that mother seen early in the first trimester, hopefully, and then followed, because if she develops a complication or the fetus develops a complication, they can take care of many of those problems. If she doesn't have prenatal care, she will present again in kind of extremis. That baby will come out and have difficulty and problems, and then many of those infants come to us as an intensive care unit to take care of them, whereas there may have been the ability to prevent some of the issues these kids have if the mother would have had good prenatal care. And it's really a access issue, and I think having insurance. And sometimes it's not just the insurance, it's actually getting the mothers program in Columbus is so essential because it educates mothers on the importance of taking vitamins, being seen, and showing up for their appointments, which is just primarily an education. I think many, especially the younger women that are pregnant, tend to be the group that doesn't show up for their first trimester appointments. So these type programs are essential, and I applaud you on that.
Twinkle, can you tell us a little bit about what you found to be effective in the education in your program?
Well, one of the things we did with education is broke it down into small bites. So we have handouts that are very colorful. There's bullet points. It's not providing a ton of education at one time. It's dividing them into like 10-minute intervals. We do a sister circle and everyone gets to participate. We move around. We do a lot of hands-on teaching because for a lot of the moms in our program, cognitive delays are prevalent, and we have a lot of people with mental health issues. We have to meet people where they are, and sometimes school was difficult. So we have to make this fun. I use the F word a lot. If you're not having fun, they're not gonna have fun. And why would you wanna come back every week? This is voluntary. And so the moms that come want to be there. It's not like court ordered or people are not mandated to come.
Stacy, I'd like to talk a little bit. African-American infants are more than twice as likely to die than white infants. Mm-hmm. What is the March of Dimes doing on this issue?
So the March of Dimes is an organization that's very focused on the health of moms and babies. And what we know about what it takes to have a baby who not only survives but thrives is that it starts with a healthy woman. It even starts before she's pregnant. So the idea of having a healthy baby, any baby, is for the mother to be as healthy as she can be, the woman to be as healthy as she can be even before pregnancy, focusing on the health, on her health during pregnancy and the health of her and her fetus. And then certainly making sure that the mother has the support that she needs afterwards before she has the next baby, which is really important to make sure there's enough spacing between babies so that the baby, the subsequent baby has a greater chance of surviving and thriving as well. One of the things that we do at the March of Dimes is we invest a lot in medical research. We have 5 prematurity research centers around the country. We just opened a new one in London with Imperial College. This is all a network of research centers, transdisciplinary research, focusing on the underlying causes of preterm birth, because we frankly don't understand why prematurity happens. I had one doctor say to me, if we actually understood how women actually deliver babies, we might know how to stop it from happening too soon. There's a lot we need to understand about how it is that women actually deliver babies, and then what are the causes of preterm birth, especially within communities of color, where we do, as you mentioned, see incredible disparities among all women of color, but especially among African American babies all around the country. So when you look at the fact that preterm birth in this country now is almost approaching just shy of 10%, and that we have some of the worst rates of infant mortality, even though they've been declining over many years in countries here and all around the world, the disparities are still so great. And our rates in the U.S. are far worse than most other industrialized countries. We have a severe crisis. And when you look at outcomes for moms and babies across the board, whether it's maternal mortality, as we just talked about in the previous panel, infant mortality, premature birth, we know that we've got a lot to do. We have an urgent crisis in this country and we have to address it. Research is really important, but last thing I'll just say is that we ought to start figuring out how to implement what we know already works. If women need progesterone and if they are at risk of preterm birth, and we know that, we need to make sure they have access to that. And unfortunately, not as many women have access to it as they need. If there are issues around preeclampsia, having low-dose aspirin, these are really solutions that are fairly inexpensive in many cases, but systematically, we're not making sure that those are available to women. So we want to make sure that we're working systematically and systemically to make sure that women have access to what they need. And if I could just put in one last word about this, which is we don't believe that there is any one institution, not the March of Dimes, no hospital alone, not even government alone, no one sector that can actually solve this. We believe that this requires a cross-sector approach. So we created something called a Prematurity Collaborative. We just had a summit here in the last couple of weeks with 300 organizations that are now part of the summit. This is a collaborative effort to bring together partners who are working together, the medical community, the entire healthcare community, government at the federal, state, and local level, to make sure that we can really align our resources and our efforts to figure out what the issues are to both prevent preterm birth, leading to infant mortality, as well as implement those things that can reduce the risk of preterm birth as well, which again is the leading cause of why babies die too soon.
And Dr. Nesbitt, there are disparities here in DC. The rates are different in DC from pocket to pocket. Can you tell us a little bit about this and what the department is doing to combat it?
Yeah, so I've been in and out of Washington, D.C. now for about 10 years. And even though our overall health has improved as a community, we have definitely left some of our communities behind. Our infant mortality rate continues to improve, but we have some disparities along racial and ethnic lines, along economic lines, and along geographic lines. One of the things that we have committed to do as a community is to not just look at what people always say is, let's go for the low-hanging fruit first. What many communities tend to do is they go for the low-hanging fruit and then they forget to go for more depth. They forget to do the things like going for what the research tells us that we need to do and to implement those solutions, because they're often complicated and complex. And they require cross-sector solutions and cross-sector partnerships. They require government and academia to work together. They require doing those significant investments that are beyond just simply saying, let's have a social marketing campaign, or let's just increase awareness about what women should know to ask for when they go for health care. They go beyond saying, let's create access to health care. We've done that here in the district. About 98% of our population is insured and has been for well over a decade. Here in the District of Columbia, we've implemented the life course approach, recognizing that healthy women have healthy babies. We've looked at the data, and we know that nearly 60% of our babies who don't celebrate their first birthday never leave the hospital. They die within the first 7 days of life. And that happens because they have experienced maternal complications of pregnancy. Prematurity is the reason, and many of those moms are not being offered 17P or aspirin when it should be offered to them. And so we've decided to commit to, again, a life course framework. We have a framework that suggests there are 7 key things that we need to do for our moms, but we also know that there are just 3 things that we should focus on. Healthy moms, again, having healthy babies, so looking at the things that we know are threats for women's health. So looking at what causes our moms to have premature babies. So it's that overweight and obesity, mom smoking during pregnancy, and having chronic health conditions that are not managed during pregnancy, and focusing on that and working with our provider community around those particular things. 56% of African American women do not enter prenatal care in the first trimester here in the District of Columbia. And so not just focusing on increasing awareness for women about their need to get into prenatal care in the first trimester, but looking at what we can do from a systems perspective, working with our managed care organizations around case management tactics, looking at the ways that we can have alerts in our systems from the time of a pregnancy test to entry into prenatal care. So doing some things more at the systems level. And then the third thing, again, as I mentioned, around the decreasing the likelihood that babies are born too soon, is working with some of our health systems that have the highest rates of premature babies being born in their system, and doing an initiative around 17P and aspirin. Our mayor has also introduced legislation called the Babies Bill, affectionately, which is better access for babies to integrated equitable services that has 4 core components to it. The first one is that by the year 2020, all of our birth hospitals and birthing facilities will be given a scorecard that determines how well they provide services to newborns and new mothers. And that will be in effect by 2020. And that will have a number of key components to it as it relates to newborn and new mom care.
And thank you so much. I mean, we could talk forever about this. It's so fascinating, but we just have a few minutes left, and I'd love to turn it over to audience Q&A to ask our expert panels anything you have. Over there.
I wanted to thank the panel for being here today. My name is Logan Sheets, and I'm with Strategic Healthcare here in Washington, D.C. Specifically to Mrs. Shockey, I wanted to say, as a student at Ohio State University, I went to a presentation you gave on campus last fall, and I just want to congratulate you for the incredible outcomes you have in Columbus, and thank you for all the work you're doing in our community. So my question to you all is, as you know, the infant mortality rate in Ohio ranks consistently amongst the worst. It's constantly in the 40s out of the 50 states, and specifically in our African American communities, it's 49th out of 50. So my question to you and the panel is, what advice would you give to organizations trying to start new initiatives within this seemingly undefeatable problem?
Well, it seems like it's overwhelming, but we can do it. We can make a difference, but it starts with us. So the knowledge and the skills that you have in this room are what's going to get us to the next level. Every single person in here can take a step today toward helping a mom that's pregnant. It could be with transportation. It could be with the food bank and volunteering at the food bank. It could be asking someone if they have enough diapers and wipes. Every single thing you do is going to be a part of the solution. It's not about starting new programs. It's about standing behind the ones that are already here. It's about volunteering. It's about, advocacy is what you do. And we need a voice. We need lots of voices. And sometimes our moms need voices. So wherever you want to fit in, it could be you walk past the program every day on your way to work. Just go in and see what they need. But if we don't ask, we're not going to know. And there's so many amazing people surrounding us that have the ability to make a difference for our babies. So I'm not going to say we're going to change the world, but we're going to change the world for that baby and that baby and that baby, and that's what it's about.
One thing I'd just like to chime in on, and I agree with all of what was just said, there is a bill that has been introduced in the Senate. It's called the Preemie Act. It was originally passed in 2006. It was renewed in 2013, and it's up for reauthorization now. Senator Alexander and Senator Bennett have introduced it. It's making its way through the Senate, and it will in the House. Now is the time to act. It is the only federal legislation that actually addresses the issue of preterm birth, which again, preterm birth and its complications are the leading cause of infant mortality. So we need that support from the federal government, but it also means that we need on-the-ground support from everyday people to advocate for changes in the state legislature, things that are coming up that could be important. Also just making sure that programs that are important, like the programs in Columbus, but also things like group prenatal care, have been proven to really reduce the risk of preterm birth, especially among women of color, substantially by up to 40%. So again, we know that there are some things that can work. Are they as available as they need to be? Can we scale them? Can we work together to make sure those opportunities are available to women who need them most? And can we educate women and build a campaign around awareness and information that makes every woman, especially a woman who's in their first trimester, for example, understand the importance, but not only understand the importance, but know where to go for help and know that help is available to them and is accessible. So.
And we are unfortunately out of time, but thank you, everybody, and thank you for the robust discussion.
Thank you so much.